Is a surgeon's ability affected by their age? There's been recent papers the last few years saying that the older you get as a doctor, more mistakes you make. But is this true? According to this article from 6 Minute News, that is not the case. More experienced surgeons actually have lower complications. They divide them in these 4 age groups based on their years of experience. There are no difference in complications despite the number of years experience between a few years out from when you finished to being 30 plus years out. There's no difference in mortality between the various groups. Here's an important conclusion. Experienced surgeons generally operated on older patients with more septic shock and kidney failure without affecting risk-adjusted mortality. In other words, the older surgeons got the more difficult cases to take on, and they had no greater problems. That's the usual case in the department. More experienced surgeons get the more difficult cases. However, it's important to note they said mortality was similar to those for earlier or less than 3 years experience of surgeons compared with the rest. However, complications were higher. So here's a crunch line. Increased complication, unplanned return to the operating room may improve with experience. So early career surgeons' outcomes may be improved if they're supported while experience is garnered. So what we've always known is that the more older, more experienced surgeons have lower complication rates. They work together with less experienced surgeons who have greater problems and challenges and help them to rise to the occasion. So there's no such thing as older surgeons having higher complication rates or mortality.